A lot of these kids have been psychotic. But how do they know to tell us that they've been hearing voices? They don't know that that was something they needed to talk about if they've had it always, right? They don't know that the monster that it's in their closet, that all kids don't have that monster in their closet that they actually see. Right? So all those things, that's why education in the office is very important also for the child and for the parent, so that you can build the picture with these symptoms. Right? That the kids aren't necessarily going to tell you, and the parents either. Right? Okay. Then we have PTSD. What's PTSD? It's an anxiety disorder. It's post-traumatic stress disorder. And what are the things that, some of the symptoms that you have are hypervigilance, right? Again, individuals that are very anxious. They can have flashbacks of whatever their trauma is, whether it's a car accident, whether it's physical aggression, right? When they have flashbacks, they could be fine. And then they smell something, it reminds them of the situation. They have flashbacks, emotional dysregulation. Boy, it looks like they're cycling. So a lot of the kids that come into the hospital, actually, that look like they're having all these mood instability, when you really look at the history, there's been a lot of abuse. And so they respond to triggers with mood dysregulation. So you have to tease out whether it's mood dysregulation from a mood disorder or is it from PTSD? Is it a flashback, right? Kids that have PTSD don't sleep very well. They're scared to death to go to sleep. Something bad might happen. Not only that, they have nightmares. And in little guys, it's very difficult for them to differentiate a nightmare from reality. So if you have a really bad nightmare, you wake up and you're in a bad mood, scared because all these things that happen in your dreams might happen during the day or are still happening. They don't know, right? If you're a 5, 6, 7-year-old. That's why they're so, terrifying. As an adult, you say, oh my gosh, it was a horrible nightmare, right? But kids can't separate them that much when they're very young. So PTSD can look like bipolar disorder as well. And a generalized anxiety disorder. Why? Because if you're anxious about everything, you can respond, okay? In that way, in an anxious manner. Now, when an adult says they're anxious, it means they're anxious. I'm scared, I feel uncomfortable, right? I feel nervous. Kids, what's anxiety for kids? They don't know what anxiety is, right? Anxiety for kids is a feeling of fear or discomfort, but they can't even describe it like that. They mainly present anxiety as either withdrawn, right? Shy, or I just want to be avoidant of the situation, or they get very angry because it's such an uncomfortable feeling that they just have a major temper tantrum or meltdown. Again, it can look like if they were cycling, but it's really anxiety. You might have actually I had a 14-year-old in the office the other day they came in for mood dysregulation. He's having the parents said, he's now having these anger outbursts, with aggression towards the brother, with verbal aggression towards the parents. The kiddo is not sleeping very well. So here we're hearing a whole bunch of mood disorder issues. To summarize, the parents are actually they're going through a divorce, high conflict divorce. The child feels like he's stuck in between because he wants to stay with his mom but doesn't want to hurt dad. So he's highly anxious. So when his brother, which is smaller than him and safer, bugs him, he responds in an angry manner, right? So it appears as if he's cycling right now. And when he's with his friends, he's doing great. There's no problem. Then he goes home and he cycles again. So is this bipolar disorder or is this anxiety disorder and adjustment issues because of the divorce? Well, it's the second thing. He's not bipolar, not even bipolar in the family. So that's how you can really kind of appreciate how difficult the diagnosis can be. Adjustment disorder has various presentations. You can have adjustment to a certain situation, right? And you can present as anxious, depressed, with emotional dysregulation, any of those. Usually the difference with adjustment disorder and any of these other conditions is that you can identify what the adjustment issue is, and it's a shorter time span also, okay? You don't necessarily treat adjustment disorders with medication. Once you identify them, it is therapy what's going to help. The medications don't necessarily help the adjustment disorder because it's more of an external factor that the kiddo needs help with their coping skills to kind of get through it. Okay, so that would be a difference there. Okay, treatment. Now, here is the big dilemma, because most of the treatment recommendations are based on adult studies. Okay? Most of the medications are approved for adults, not necessarily for kids. So we're going to talk about what FDA approval is. Now, we have a lot of factors that we need to think of in kids as well as in adults, but even more so in kids, because when you think about it, if you're 5 years old and you're going to be on medication, it's very different than if you're started on medication at the age of 30, where your organs, which include your liver, your heart, your thyroid, and all that, are pretty much already developed, right? Your metabolism is pretty steady. To a child that you know is still developing, their brain is still developing, their organs are a little bit more susceptible to maybe the potential side effects of medications, and they're going to be on medication 30 years longer than what that person was on medications that started at 30 or 35. So you have to think about all these things as well when you start kids on medication. So the first thought is you don't want to start them on medication, so you better have a clear idea of why you are starting them on medication, okay? Medications usually take some time to kick in, so you really need to think about what the emergency is. If there is a safety emergency, then you always think about maybe bringing them into the hospital, right? If they're self-injurious, if they're harming themselves or others or have a high potential, because there isn't a medication that's going to fix that and you can just send them home, okay? So again, medication always with caution. How do you choose medication for kids? In general, you have to think about how effective they are. Again, the studies don't, you only know how effective a medication is through research if it's been researched, right? So just because it hasn't been researched doesn't mean it's not effective. You just don't have the data on it. So that's one of the dilemmas of medication in kids. Phase of the illness. The type of medication you choose for an acute situation is different than for a maintenance. In other words, they're stable, but you have to maintain them for years. It's very different than if they're having a psychotic break in that moment and they're being aggressive or there's a safety issue. Okay? So you have to think about the phase of the illness. Like I mentioned, additional symptoms such as psychosis. You can have mood swings without being psychotic, but if you're psychotic, then you need to use an antipsychotic, okay? The side effects and safety as well. When you have, just to give you an idea, if you have a 8-year-old that is obese and an 8-year-old that's underweight, you're already thinking different types of medications because you want to use the side effects to your benefit. And you want to make sure that the side effects don't worsen other conditions, like obesity. Okay? So you have to think about all these things and bring them together to be able to make the choice of the medication. History of medication response is very, very important. If you have an adolescent or a young adult that comes into your office, they've usually been on medication already, right? So you just get the medication history, how they respond to one, how they respond to another, what potential side effects they've had, as well as in the family, how the family members have responded. Remember, there is a genetic link, right, or predisposition to most of the mental health conditions, but there's also a genetic link to response to medication, right? It's not a black and white situation, but if a parent usually has responded quickly to Lexapro, it's it's more probable or possible that the kiddo is going to respond. So why go through all the other ones, right? So taking that into account plus all the other stuff into account, then you start choosing the meds that you need. Okay. Preference of patient and family. If you don't have, as a parent, a good understanding of why the child needs the medication and what the medication does and what it can potentially do, would you even say yes to the medication? No, I wouldn't say yes, right? So it's very important that the parent understand And it's also important for the child to understand. So there's compliance with the medication. They don't need to understand all the biological, scientific mumbo jumbo behind it, but kiddo, you're aggressive, it makes you feel angry. This is what the medication is for, right? For the anger. So you have to identify the symptom. At this point, when you're choosing medication in children, and you're talking about mood disorder, you're not saying bipolar disorder, you're not necessarily saying depression, you're saying there is a mood disorder, I'm not sure if it's bipolar, it might be bipolar later on in the future. So, how do you treat, right, if you don't have a clear diagnosis? Well, the way you treat is you prioritize by symptoms, okay? So what are the main symptoms that are affecting this child? The kiddo is, they bring him in and he's kind of fidgeting in his chair and really not paying attention, right? But he's also reported that he hears voices and he sees things. So do you treat the fidgetiness and the inattention, or do you treat the hallucinations, right? And I don't even know what the diagnosis is yet, but I already know what we're going, because you have to think about safety first, okay? Now, safety is a very important part of the treatment, which is keeping the child safe, especially if they're psychotic, especially if they're suicidal or homicidal. When you have an agitated individual, a lot of energy, and a lot of anger or a lot of sadness, it's very likely that they will follow through or act out on what they're thinking, right? So the treatment is not medication at that point. Sure, you're going to use medication to help their agitation and get rid of the hallucinations, but the treatment at that point is hospitalization, because that's where you're going to keep them safe, right? Do most kids want to come into the hospital? No. So whose decision is it? It's the parent's decision with the physician. And why I bring that up is because I can't tell you how many parents turn around and go, now, do you really want to come into the hospital? Is that something that you want? Don't even put them in that spot. That's not even a decision for them to make, right? And the parents feel also that if they do bring them into the hospital, that the child is going to hate them for the rest of their lives. Well, hopefully they will have the rest of their life to hate you, right? For that, which means they don't hurt themselves. And that's kind of the sad reality is that if you don't get help for these kids, it's very likely that they will harm themselves, and suicide is very, very high in kids with bipolar disorder that are not treated. Okay, so you always have to think about those safety issues. Okay. We're going to talk about FDA approval. What does that even mean? You know, we always think about if the FDA says it's okay, then it's fantastic. If the FDA says it hasn't approved it, then we can't use that medication. Okay? That's kind of our general thinking because the FDA knows everything, right? The FDA is basically an entity that says you as a company can market this medication for this illness, right? And you can market it and make really nice, commercials for it because we have looked over all your research and it says that it will work for this condition, right? So we go back to, if it's not FDA approved, it doesn't mean it's not good for that condition or can't be used for that condition. It just means that they don't have enough research that they are going to say, we are going to put the okay stamp on it. We don't have a lot of research in kids compared to adults, so we have a lot of medications that are not FDA approved. So how do we know and why do we use them? We use them based on how they affect adults, although kids are not little adults, right? And also just from kind of clinical experience. There is plenty of literature on how medications affect kids, right? But not all the research enough for all of the meds to be approved by the FDA. Any questions about that? It's just very important because a lot of parents will say, well, this medication is not approved for kids under 18 years old, right? And you go, but this is the one that is, I recommend because of this and this and this. And sometimes it's difficult because you don't want to put a medication that you feel that might be dangerous, right? Bottom line is all medication can potentially be dangerous if you don't use it correctly or if you don't follow the individual, the patient, correctly. Okay, so FDA-approved meds. Lithium is an FDA-approved med. Lithium is a salt that has been used for many, 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 many years. Okay? There is an ADHD supplement that you can buy at the GNC that I'm going to tell you the story. I had this patient that came in, really high-functioning parents. And when I say that, very high level of education, very in tune with their kids. The child is, you know, all straight A pluses. I mean, very high-functioning kiddo. Some inattention and some mood dysregulation. Dad is diagnosed with bipolar disorder already. Stable though, not an issue, responds very well to medication. So she comes in and they're very reluctant to medication because she's high functioning, and I guess her level of, let's say, of changes in her milieu and the way she interacts was not so severe that medication really needed to be started at that moment, okay? Then they go and they're going to go to the GNC and they're going to get some omega-3 fatty acids, some supplements, and they find this ADHD medication. Okay? Then they bring the ADHD medication that has really done a fantastic job on her mood, but has done nothing for her ADHD. And you look at it as lithium in it. Dad bipolar, mom has a mood disorder, and the kiddo is, oh, that's why, because maybe what we're seeing is the start of a mood disorder, and they're treating them with lithium off the, you know, at lower levels. But very interesting, because it, you know, it kind of gave us an idea of which direction to go. So, lithium is approved, and we will talk about lithium in a little bit with all the things that we need to consider with lithium, because it is a very effective medication, but it comes with potentially a lot of side effects. And again, we're talking about starting kids at a very young age, and so they will be experiencing and dealing with their side effects for a much longer period of time. Okay? And then we have the names of all the other medications that are approved, the antipsychotics, and again in adults, approved for acute mania, and the mood stabilizers.